In today's Eye on Health, we are talking about important info you need to know about this year's flu shots.
Who should get them, why we should get them, and when is the best time to get your shot. Mikey Hood has the answers for us in an interview that first ran last week, but many of you didn't see it because of a CBS News special report that interrupted our show. So take a look now.
I saw on the monitor that we do have it.
Hey, Heather, David, good morning. Yeah, you're right. There are lots of questions, lots of confusion out there about the flu shot, flu season, and how it relates to COVID-19. And we're going to clear a lot of that up today. Dr. Mark Itzkowitz is here from AHN. He's a primary care doctor here. Good morning,
Good
doctor.
morning. How are you today?
Good. So you're going to answer a bunch of questions for us. But first, let's talk about how this season has been kind of named a twindemic.
Yeah, some people have used the term twindemic, suggesting that there will be two pandemics going on at the same time. We all know about COVID, which has caused a worldwide pandemic. In some years, the flu can cause a pandemic. And so our concern is that we have to be cautious going into flu season and do everything we can to try to prevent this twindemic.
And let's talk about some of the symptoms, how like COVID-19 and the flu, those symptoms sometimes can be similar, correct?
They can. They're both primarily respiratory illnesses that are contagious. So symptoms like fever, cough, shortness of breath are similar both to COVID and the flu, but there are also some important differences. We know that COVID-19 is much more contagious. We know that the mortality rate is much higher for patients with COVID-19. But remember, the flu is also something that's very important to prevent. We know that every year many people get sick and go to the hospital with the flu. So we are focused right now on preventing a serious flu season.
And if you're at home and you're having symptoms, how do you just kind of tell the difference?
It's going to be hard, to be honest, and that's one of the reasons why we're going to recommend the flu shot widely this year. Remember that a fever, cough, and shortness of breath will be similar for both, and so likely if you develop those symptoms, we're going to have to test you for both COVID and the flu. Now, the flu also causes some more distinct symptoms like a frontal headache, muscle aches are more common with the flu. And with COVID, we've seen a variety of symptoms, neurologic symptoms, digestive symptoms. So it will be challenging for clinicians. And so if we can prevent people from getting the flu, we should do everything we can in our means.
Yeah, and you mentioned, I mean, the flu shot is really important now because the hospital system is already strained, right?
Yeah, and fortunately we've done fairly well in Western Pennsylvania. Right now our caseload from COVID-19 is low, but we expect that cases will pick up again as they have in other parts of the country. We can prevent the flu with good hand washing, with social distancing, wearing a mask. All the same things that we've been talking about for the last 6 months with COVID actually should help to prevent the flu. But the one important difference is we have a vaccine. This is a vaccine that's safe and it's effective. We know that it prevents the risk of severe illness with the flu, prevents risk of hospitalization with the flu, and so we widely encourage people to get it.
Yeah, and that'll be coming out sometime soon, hopefully, right?
So the COVID vaccine is probably going to come out towards the end of the year, probably won't be available for the general public until 2021, but right now is really the time to focus on the flu vaccine.
Right.
It is widely available this year, there are no shortages. It's really recommended for everyone in the population 6 months of age and older, unless they have a very rare reason they can't get the flu vaccine. And so this is the time to think about getting the shot.
Here's a question that's out there. Does the flu shot prevent against COVID-19?
It does not, unfortunately. It would be great to have one shot to protect against all viruses. We don't have that yet, but the flu shot does provide protection against influenza. Some years it's 50, 60, 70% effective. And again, if you get the flu having gotten the flu vaccine, your chances of a severe illness are much less. And so we really encourage people to get the vaccine. September and October are the best months of the year to get the flu vaccine. And we're hopeful that if people follow the COVID precautions and get the flu vaccine, we'll have a good season.
And what if you're one of those people out there who just never gets the flu shot and or feel like, I've heard that maybe it makes them sick or get flu-like symptoms?
So you're not alone. We know that only 40% of Americans get the flu shot each season, and that's disappointing to the healthcare system. We know that the flu vaccine works and is safe. For people that haven't gotten it before, they should talk to their doctor or their healthcare provider and explain, what are their reasons, what are their concerns. The most common reaction is either no reaction at all or soreness in the arm, and it usually only lasts a few days. Some people will get a little bit more of a reaction, like a low-grade fever, but remember, the flu vaccine is an inactivated or killed vaccine, meaning you cannot get the actual flu from the vaccine.
Mm-hmm. Well, Dr. Suez, thank you so much. Some wonderful information and some tips. Heather, David, we'll send it back to you. I learned a lot this morning.
Yeah, our thanks to Mikey and Dr. Iskowitz for all of that important information. That's why we wanted to rerun the story.
Right, it really is, especially this year, important information. And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.